so the recording has started this evening. We'll get going and get it started over on our pathophysiology. I'm sure this probably is just a refresher for most of you guys, so we'll get going. There's roughly 70, 68, 69 slides, so we'll get through it. It won't be too painful. All right, so dive off into this. So pathophysiology is the part of integrates where the comprehensive knowledge and pathophysiology of our major human systems. So when the body can no longer maintain some homeostasis and disease may result from that. So to understand some of our disease process, you got to understand the ways that disease alter the structures and functions of our cells within our body. All right, so when exposed to adverse conditions, cells do undergo a very adverse reaction. So atrophy is a decrease in cell size due to the loss of some subcellular components. Hypertrophy is an increase in the size of cells due to the synthesis of more subcellular components. Hyperplasia is an increase in the actual number of cells in a organ or tissue. Dysphagia is an alteration of the size, shape, and organization of the cells. And metaplasia refers to the reversible cellular adaptation in which one adult's cells types is replaced by one another. So our human body is composed primarily of water. We've learned that for a long, long time. We know that for certain percentages of water, and then we break off into other types of fluids. So changes in the fluid and the electrolyte balance that disrupts homeostasis can either cause or exacerbate certain types of diseases. So excessive output or input of fluids can upset homeostasis also. A degree of fluid imbalance is required to compromise homeostasis depending on our patient's size, age, and some underlying medical conditions. The fluid therapy is a very big fundamental step in resuscitation. All right, so edema. We all know what edema is. The easiest way to check edema is when you take two fingers, you kind of push in on their feet as you're shown there on the screen, and you may start to see where it's causes pita edema. Whew. All right, so let me see what this. I'm getting all the messages from the other class too, so that's on my screen. I'm having to go back and forth because I'm making sure that some of the comments are in the other class versus ours. All right, so what causes edema? So we have increased capillary hydrostatic pressure. The allergic reactions are you have some inflammation, causes venous obstruction. Pregnancy will cause it heat stress. Now you have some decreased colloidal osmotic pressure in some of the capillaries. We will then have some decreased production of plasma proteins in our patients with liver disease, or they have severe protein deficiencies. Now, increased loss of plasma proteins from the kidneys or extensive burns creates a lot of edema, obstruction of lymphatic vessels. The clinical manifestation of edema may be local or generalized. Majority of the time, you're going to see it in the lower part of the extremities. In-depth physical assessments include auscultation of breath sounds, see if we happen to hear any type of fluid there, evaluation for pedal and sacral edema and jugular vein distension. You may notice some changes in their vital signs, and then our definitive treatment depends on what that underlying medical condition is. So isotonic fluid, what is the difference between isotonic and well, y'all tell me this. What's the difference between LR and normal saline? That's a question.
How much sodium content?
LR has like electrolytes and stuff in it, right? And the normal saline's just straight like salt water.
All right. So I heard somebody else too.
I said sodium content.
Yeah. So the easiest way I kind of break that down is think about LR as more of it has more viscosity. It has more thickness to it. So if we have a patient that's bleeding out, do I want to give them LR or do I want to give them normal saline?
LR.
Okay, because that's more of a, it's more of we have the viscosity that's there. So that's what we want to try to shoot for. All right, so now that we know the difference, so isotonic fluid is we use it in a decrease in an extracellular fluid with a proportionate losses of sodium and water, and most common form is a fluidus. So isotonic fluid excess is I have trouble with some of the words they put in here. That's why I'm like, what is that? Proportionate increase of sodium and water in extracellular fluid. We do kind of see that a lot in your kidney and heart failures. That will a lot of the most common causes are the kidney and heart failure. You'll start to see that the need of that is there because you lose a lot of those proteins and sodiums and all that. All right, so electrolyte imbalance. So sodium regulates fluid balances the total volume and blood pressure in a human body, which we get that. We know the more fluid we can, the less fluid they have, the more unstable their vitals are going to be. So this facilitates muscle contraction and nerve impulse transmission. The hypertonic fluid occurs due to the disproportionate loss of sodium during water loss. So hypernatremia is a serum sodium level of 143 milliequivalents per liter of higher. Hypoproteinemia is a serum sodium level of 135 milliequivalents per liter or less. The causes of hypernatremia and hyponatremia include some excessive sweating and heat or during exercise. You have some gastrointestinal losses through vomiting, diarrhea, and then inappropriate uses of IV fluids. Are we choosing the right fluid? Are we choosing the right drip set? We want to make sure it's 60 or 10 drop sets. We need to know which one is more appropriate for which particular setting. Potassium. All right, so I'll tell y'all a little side base on this. When we get into cardiology, we'll pick it up more. So when you have a patient that's showing pretty predominant T waves, you can also kind of have an idea that they're having potassium imbalance issues. So you see that T wave that's a little bit higher, or you see the higher increased potassium waves, T waves, you will notice that the easiest thing to do is ask them, say, hey, by any chance, what color is your urine? Well, the reason why I want to know that, not just trying to say, hey, man, you're dehydrated or not, is that tells me the darker, the more yellow to brownish that it is that there a imbalance that's going on that we're going to have to overcome. So potassium, that is very crucial to the cellular functions. It helps them tremendous to have that potassium. Neural serum level of potassium ranges from 3.5 to 50. I really, honest to goodness, don't expect y'all to know that or memorize that. That's one of those that you can't do lab values in the field. You don't have ways to draw blood and start spinning it and seeing the particular lab values. So the more you get into paramedic, you need to know what your baseline vitals are or baseline levels are. Hypokalemia is a decreased serum potassium level. That does some of the causes are decreased dietary potassium intake and absorption. You have the decreased shift of potassium into the cells, renal potassium loss, and external potassium loss. Hyperkalemia is an elevated serum potassium level. Now, what causes this is decreased excretion, shift of the potassium from the cells, and then excessive dietary potassium intake. So overtake of that potassium can also cause them some issues. So you have some that like to take the bananas and like to eat bananas and they like to stay healthy and all that. Well, too much potassium can be just as bad for you as not enough. So keeping that in mind, it's hard to figure out exactly what the perfect intake is unless you see a particular like nutritionist or something like that that can get all the information collected and send it to you and tell you what the best is. So calcium, nearly 98% of the body's calcium is found in the bones and our teeth. It lends strength and stability to the collagen and the ground substance that is from the matrix of the skeletal system. It does enter the body through our gastrointestinal. Let's start this over. It enters our body through the gastrointestinal tract. The normal serum, as y'all see there, is from 8.2 to 10. Hypocalcemia is a decreased serum calcium level that does caused by decreased calcium intake or absorption, increased calcium loss. You have some endocrine disorders that create that calcium loss, and sepsis or that infection. Hyperkalemia is an increased serum level that is caused by increased calcium intake and absorption again, endocrine disorders, and neoplasm. All right, so right there is an illustration shown on your screen, shows the regulation of body and calcium. I'm gonna let y'all look at that real quick. I'll take a drink of water. All right, moving on. Phosphate is primarily an intercellular anion. It is essential to many body functions. That's gonna get me there. Yeah, y'all can read that just as well. I'm from Central Mississippi, folks. Y'all gotta bear with me. So it's a decreased level of serum phosphonate. Some of the causes are decreased supply of absorption, excessive loss of phosphonate associated with the use of diuretics, intracellular shift of phosphones, and the electrolyte abnormalities. You may also have some abnormal loss of nutrients followed by an inadequate replenishment. You have your hyper word that I cannot pronounce is an increased level of serum phosphonate. Some of those causes are mass loading of phosphonate into the extracellular fluid and decreased excretion into the urine. Magnesium, 50% of the body's magnesium is absorbed through the bones, 49% in other body cells, and then that 1% is in our extracellular fluid. The normal range of magnesium found in our body is 1.3 to 2.1. Hypomagnesemia, magnesia is a decreased level of serum magnesium caused by a diminished magnesium absorption or intake, increased renal loss of magnesium, and miscellaneous causes such as diabetes, respiratory alkalosis, and then pregnancy. Hypermagnesemia is an increased level of the serum. It almost always occurs as a result of some kidney issues. If you have your book, there's a little thing on 8.2 that does also give you some summarization of the electrolytes of the body. All right, so pH. So we check pH in urine a lot in the oil field to check to see on their hydration level. What part of that scale are they on? Are they more acidic? Are they we just want to know their pH so we can help hydrate them properly. There's a way to, when we start worrying about trying to hydration and all that, we don't want to overhydrate them and then put them into shock, but we want to slowly start increasing that pH. All right, so the lower the pH, the higher the acidity, and the acidosis is an increase in the extracellular H ions. Alkalosis is a decrease in the extracellular H ions. The disturbance of acid-base balance are associated with disturbances of potassium balance. Types of acid-base imbalances or respiratory acidosis is related to the hyperventilation. Now you will see that in airway obstructions. You have that in cardiac arrest. Overdose of a CNS depressant drug. You will also have some acid-base imbalances due to submersions, respiratory arrest, pulmonary edema, a closed head injury, some chest trauma. And then signs and symptoms of respiratory acidosis are systemic or cerebral vasodilation. You could see both of those at the same time. You may have a headache or be feeling very lightheaded. There'll be warm, flushed skin. You may notice some CNS depression. You may notice bradypnea, which is very slow respiratory rate. And then again, everybody's worst fear is nausea and vomiting. I hate nausea and vomiting. People start throwing to be sick. Oh, I feel like I'm gonna be sick. Man, I got more drugs than you can shake a stick at. All you gotta do is tell me I don't feel good. I'll fix that. I can't do vomit. Sorry. So respiratory alkalosis is associated with those conditions that result in hyperventilation. The level of circulation carbonic acid is reduced. Hyperventilation accompanied by some corporeal spasms is this classic sign of some respiratory alkalosis. The causes of hyperventilation and respiratory alkalosis are drug overdoses, fever, overzealous bag mask ventilations. Some signs and symptoms of that are diminished level of consciousness. You have that lightheadedness, corporeal spasms, chest tightness, some confusion, vertigo, blurred vision, and then again, nausea, vomiting. Metabolic acidosis is any acidosis unrelated to the respiratory system that is considered metabolic. Some of the causes of metabolic acidosis include lactic acid acidosis, ketoacidosis, aspirin overdose, excessive alcohol indigestion, or alcoholic ketoacidosis, gastrointestinal losses, carbon monoxide poisoning. And then what does that look like? So our signs and symptoms, we talk about some vasodilation, CNS depression, headaches, warm flushed skin, nausea and vomiting, and cardiac dysrhythmias. So the metabolic alkalosis occurs due to the extensive loss of acid from the body. That is rarely an acute condition, but it is common among chronically ill patients. Some of the causes, you will notice some excessive vomiting, excessive water intake, nasogastric suctioning, excessive intake of alkaline substances. Signs and symptoms of that are confusion, muscle tremors and cramps, bradypnea, and hypotension. What is all that? As I was reading, what does that kind of remind you of that you see more than anything else? Maybe I'm focused on one particular area, but what does that kind of remind you of when you hear those signs and symptoms? How about some heat-related emergencies? You start to notice those cramps, the confusion. You will see a lot of that in those heat-related emergencies. All right, cellular injuries. You talk about some various processes may cause some cellular injury. We talk about hypoxemia. Hypoxia is the lack of oxygen. Ischemia is the lack of the blood supply. You will see the chemical injury, infectious injuries, physical damage, mechanical injuries, and then inflammatory injuries. Manifestations of cellular injury occur at the microscopic level. This is definitely not something we're going to see all the time. Some common microscopic abnormalities are cell swelling. You have the rupture of cell membranes and nuclear membranes, the breakdown of that nuclear material, such as chromosomes. Some of the functional disturbances that we will see will be insufficient oxygen utilization, intracellular acidosis, toxic waste accumulation. Let's see, dysfunctions in one system affects the function of another system. Cellular injury can be repaired up to a point with some proper treatments. Hypoxic injury may result from decreased amounts of oxygen in the air. You will have some loss of hemoglobin functions. You'll see that decreased number of red blood cells. You'll notice the disease of the respiratory and cardiovascular system, and cells that are hypoxic for more than a few seconds produce mediators, which lead to some more cell damage. Those free radicals are the earliest and most dangerous mediators produced by those cells. Are we going to see that? Nope, that happens at the cell level. So the chemical injury, a variety of chemicals may and then ultimately destroy those cells. Some of the common poisons include cyanide and pesticides. Cyanide induces cell hypoxia. Pesticides do prevent proper transmission of nerve impulses by blocking the enzyme. Long-term ingestion of lead that leads to brain injury and neurologic dysfunction. The carbon monoxide does prevent adequate oxygen of those tissues. And then hyper doses of ethanol produce severe CNS depression. So this is where we start to see a lot of the, I'm just catching up on y'all's chats, sorry. I'm with you, Mark. Don't feel bad, I promise you. I'm giggling at your picture. That was a good one. So when we talk about your chemical injury, that's why you see a lot of that into your chemical weapons. You start to see that in terrorism acts that they use those because it can long-term affect those people. So once it's dispersed into the air, that's where we get those airborne terrorism issues that we've heard in the past. It's where you have a lot of your agencies that have those gas masks that are on there, but at the same time as you got to know what particular particulate filter you need depending upon what's in the air. Infectious injuries occur as a result of some invasion of bacteria, fungi, and viruses. So, depression immune system is less capable of fighting off microorganisms. We talked about that the other night, and we think about your pediatrics. They do have that depressed immune system because there's not enough in their immune systems yet to help fight that. White blood cells do release indigenous pyrogens. Some viruses take over the metabolic process of the host cell and use the cell to replicate. A virus consisting of nucleic acid, core, or RNA, or DNA. So you get these pretty severe viruses that they'll sit there, they make you septic, you become very high in acidity within your body. That's when we have those tendencies to have a lot of hard times helping those patients out in the field, and their most definitive care is going to be into the hospital. And we spend a lot of time just rushing those patients there is because we have a very small amount of medication to provide them in our ambulances, but they have vast majorities of that antibiotics within the facilities to help them out the most. So many bacteria have capsules that protects them from ingestion and destruction by those phagocytes. There's some pictures there that shows you of the cell wall, and I'm sure when y'all get ready to take medic, you'll have to go through A&P, and you will know every bits and pieces of those cells. All right, immunology and inflammatory injuries. So the inflammation is a protective response that occurs in the presence of a cellular injury. Inflammatory response can be triggered by a physical, chemical, or microbiologic agent. Signs and symptoms, signs of inflammation are heat, redness, tenderness, swelling, and pain to the areas. If the inflammatory process is severe, systemic effects become very evident. A person feels ill and the body temperature is elevated. You will see the bone marrow accelerates in producing of leukocytes, so the number of leukocytes circulating in the bloodstream does increase. An outcome of an inflammation response depends on the amount of particular tissues injuries. To go back to some of the comments we've seen, yes, a lot of this just has to be covered before we dive off into the real fun stuff. So please bear with me. I know a lot of y'all are like, oh my God, what's he talking about? I get it. I promise you I do. So y'all just bear with me. All right. So here you're looking at the different type of the immunologic and inflammatory injury. So the bone marrow accelerates its process of leukocytes. So the number of leukocytes that circulate in the bloodstream does increase. That is leukocytosis. All right, injury genetic factors. So the abnormal gene may develop by mutation of the gene during meiosis. You may get it from hereditary reasons. As a result of some other causes later in life, you may grow into something. You may get it from another particular type of sickness that you have. Some genetic factors that may damage cells include chromosomal disorders, premature development of arteriosclerosis, and sometimes obesity. All right, so include of obesity, malnutrition, vitamin excess deficiency, or mineral excess deficiency. I'm not real sure why that's in there. Really doesn't bring a whole lot there. We've already talked about that. Physical agents such as heat, cold, radiation may cause cellular injury. Obviously, burns, frostbite, radiation sickness. A degree of cell injury is determined by strength of agent and length of exposure. I went to a program years ago over in Alabama. They expose you to some live agents, and you get your body reacts to certain ways, so you know how to treat it. Yes, it's one of the worst classes I've ever been to because you feel like trash the whole time. But it's a knowledgeable thing. You get this because they physically have exposed you to a lethal, a very not a lethal dose, but they expose you to enough that you feel it, you understand it, you're able to function, but it's not enough to lethal dose you. Now I'm telling you, there's a lot of antidotes sitting around as you're messing with all this these chemicals and all that. So it was one of the hardest, but one of the best ones at the same time. So apoptosis is normal cell death, genetically programmed into the cells as part of a normal development, immune function, and tissue growth. Unlike in the case of cell death from disease process, proteins and DNA undergo controlled degeneration that allows remnants to be taken up and reused by those neighboring cells. So if they're dying and the other cell needs this or that, they're able to absorb it. It can be activated prematurely by pathologic factors such as some particular cell injuries, and then inhibition of normal course of apoptosis allows destructive cells proliferation. There's some big words in this chapter. I'm proud of myself. I still can't say them. All right, so right there is an illustration, shows the process by which cancerous cells develop in the normal cell. So an abnormal cell death, necrosis, is the term used for tissue death. Let's throw this out there. Who knows what is one of the drugs we use a lot, but is the most necrotic that we have in our bags? Anybody have an idea?
D50.
You got it. Jared, where are you from?
I'm from Berg, Louisiana.
I could pick it up. I
He
knew it.
works on an ambulance in Bayou Cane. Don't let him fool you.
Oh.
Are you jealous they don't have ambulances, Chris?
They got buses. Is that what you're saying? So that is the most used drugs that we have that is very acidic. You have to, every time I push D50, it worries me more than adenosine just because of what it does. I'm a slow pusher on everything that I push, but when I push D50, I'll push like 250, I'll back up, I'll infiltrate it, and I'll push some more. I'll make sure I see blood, and then I push more. I pull back, make sure I see. I'm weird like that because I've had that drug scare me multiple times, even though it works amazing. It's just one of those that makes me very nervous. All right, did I read all that? No, I didn't. Some simple necrosis refers to an area of necrosis where gross and microscopic tissue and some of these cells are recognizable. They may be caused by acute ischemia, acute toxicity, or some direct physical injuries. Yeah, you have your diverted necrosis includes cessation, necrosis, dry gangrene, fat necrosis, and liquidification necrosis. Whew. Jesus. Hypoperfusion is the delivery of oxygen and nutrients and the removal of waste by the circulatory system. Adequate circulation depends on a pumping heart. Obviously, that is the core of it. So that one's simple. Intact vascular system and an appropriate amount of oxygen carrying throughout the body. Hypoperfusion occurs when the level of tissue perfusion decreases below its normal range. In response to hypoperfusion, the body releases catecholamines or epinephrine and norepinephrine, which produce an increased strength of cardiac contraction, increased pulse rate, some vasoconstriction, and increased systemic vascular resistance. As hypoperfusion persists, myocardial strength does start to increase. Shock is an abnormal state associated with inadequate oxygen and some nutrient delivery to the metabolic apparatus of that cell. Results in impairment of cellular metabolism and inadequate perfusion of some of your vital organs. If the body is compensating, some mechanisms are sufficient to stabilize the patient's condition, and then the shock is called compensated shock. If hypoperfusion overwhelms normal compensatory mechanisms and the patient's condition progressively deteriorates, we know that is decompensated or hypotensive shock. That was a mouthful just to say compensated and decompensated shock, but I wanted y'all to know what it was. So, shock can occur as a result of some inadequacy of central circulation or the peripheral circulation. Central shock. Cardiogenic shock occurs when the heart cannot circulate enough blood to maintain an adequate peripheral oxygen delivery. Most common causes of cardiogenic shock is myocardial infarction. The obstructive shock occurs when blood flow becomes blocked in the heart or the great vessel itself. Ooh, look, there's some good pictures. All right, so these pictures right here show the cardiac tamponade following a myocardial rupture. On the left side is the distended pericardial sac, and then on the right side is a pericardial sac that is opened, showing clotted blood surrounding the heart, which compensated the heart and prevented filling of the right ventricle and sorry, I'm trying to read two things at once. Neither one of those look good in my opinion. I'm just going to tell you. It looks like that heart is surrounded by a lot of fat. All right, so right there is an illustration that shows the sites of the thoracic aortic dissection. A tear in the ascending aortic causes some proximal and distal dissection. A tear in the descending aorta may cause extensive distal dissection. How fast is these patients going to perish? Somebody tell me.
Very quickly.
Is there anything that we can do in the field? Nothing.
Right.
It's very if they're sitting on the table and they had a rupture right in there, it's very very small chance that they're going to be able to survive that.
Diesel therapy.
Say that again.
Diesel therapy.
You right, baby. Just give me some pourings. I want gallons. I don't want ounces at that point. All right, some peripheral shock. Let's before we dive. Let's finish this, and we'll take a break. We only got 2 more slides. All right, some peripheral shock. So hypovolemic shock, the circulating blood volume is inefficient to deliver some adequate oxygen and the nutrients to the body. There are two types of hypovolemic shock. You have your exogenous and the endogenous. Disruptive shock can occur when there is a widespread dilation of the resistance vessels um, and the capacitance of vessels or both. Anaphylactic shock, we've all seen that at least once in our career, but that is when a histamine or other vasodilator proteins are released on an exposure to an allergen. Septic shock occurs as a result of some widespread infection, and the neurogenic shock usually results from a spinal cord injury. All right, so the picture before we take a break. So this picture shows how some damaged spinal cord can cause some substantial injury to the part of the nervous system that does control the size and muscle tone of blood vessels. If the smooth muscle in the blood vessels that is cut off from its impulse to contract, then the vessels dilate widely, increasing the size and capacity of the vascular system. The blood in the body can no longer fill the enlarged vessels, which results in inadequate perfusion and neurogenic shock. Like I said, we're going to have a little break right here. We don't have that much longer. We're about halfway done. So you guys take about 10 minutes and we'll come right back. I can get my computer to work. All right, so management of shock. What are we going to do? So most types of shock are categorized by the reduced cardiac output, the circulatory insufficiencies, and some rapid heartbeats. Determine the presence and absence of shock, evaluate the presence and volume of the peripheral pulses, and assess the end organ perfusion and its function. Some prolonged capillary refill time does start to increase, indicates our shock. Some molting, pallor, and peripheral or central cyanosis, and some delayed capillary refill time may signal the presence of shock. So multiple organ dysfunction syndrome, or MODS, is a progressive condition that occurs in some critically ill patients. It's characterized by the concurrent failure of two or more organs or an organ system that were initially unharmed. Respiratory, hepatic, renal, hematologic, neurologic, and cardiovascular systems are surveyed during the MODS. Overall mortality rate varies widely depending on the underlying etiology and ensuring diagnosis and treatment. So MODS occurs when the injury or infection triggers a massive systemic immune, inflammatory, and coagulation response accompanied by these releases of toxins. Primarily, MODS is a direct result of an insult, such as pulmonary contusion. Secondary MOD is a slower, more progressive organ dysfunction. Immune system includes all the structures and processes associated with the body's defense against some foreign substances. Several anatomic barriers decrease the chance of a foreign substance invading the body. Some examples of that include skin, the hair in the upper and lower respiratory tracts, and acid in the stomach. The body's defense reaction to any foreign substance is directed against the invading microbes, bacteria, or viruses, some of the foreign bodies, and abnormal cell growth. The initiate response starts first and is then reinforced by the more specific acquired response. Components of the cell wall then activate the complement system. Chemotaxins attract leukocytes from the circulatory to help the circulation to help fight the infection. The complement cascade ends in the formation of a set proteins called the membrane attack complex. Types of immune system cells include basophil, neutrophil, monocyte, lymphocyte, macrophage, mast cells, plasma cells. You have some B cells or B lymphocytes. You have your helper B cells, memory B cells, and your T cells. So some natural or native immunities is a non-specific cellular and humoral antibody response that operates as the first line of defense against those particular pathogens. With acquired immunity, the immune system will never fail to recognize the same stimulant when it is subsequently encountered. Passively acquired immune is the receipt or of performed antibodies to fight the previous infection. The primary or initial immune response takes place during the first exposure to an antigen. An antibody binds to that specific antigen, and an immunology is an antigen capable of generating an immune response. A heptin can be combined with any antigen to initiate a specific antibody response on its own at a lateral time. In humoral immunity, B cell lymphocytes produce antibodies called immunoglobulins. B cells are born in the bone marrow and must be first activated to produce those antibodies. The antibodies secreted by B cells are called immunoglobulins. I expect y'all all to memorize that. All right, there's another picture on shows how those antibodies work. Let y'all look at that again. All right, so antibodies make antigens more visible to the immune system in 3 different ways. Some antibodies act as opsonose and opsonization, and antibody coats an antigen to facilitate its recognition by immune cells. Some antibodies cause antigens to clump. Antibodies bind to and inactivate some toxins produced by those particular bacteria. Cell-mediated immunity is characterized by the formation of a population of lymphocytes that can destroy foreign material. Subgroups of T cells are known as killer T cells, helper T cells, suppressor T cells, memory T cells, and leukophil-producing cells. All right, right here shows B cells, some of the activation. Immunocompetent B cells are stimulated by the presence of an antigen, producing an intermediate cell, the lymphoblast. The lymphoblast divide, producing plasma cells and some memory B cells. Those memory B cells respond to subsequent antigen encroachment, yielding a rapid secondary response. All right, right here shows the interaction of cells mediated and humoral immunity. A macrophage processed antigen fragments to those particular T lymphocytes. The B lymphocytes processes the inact antigen and displays fragments of the same antigen on its cell membrane. The T cell lymphocyte, which has responded to the same antigen, stimulates the B lymphocytes. It makes them mature into plasma cells and makes the same antibodies to help fight those. All right, this shows the general structure of an antibody. Now, make sure you note here that the immunoglobulin, or the IgG, is a monomer. It is one molecule. The immunoglobulin, or the IgM, is a pentamer. It is a cluster of 5 antibodies that is effective in combining with foreign antigens. Also, make sure that you note that the antigen fits exactly into the antigen binding state. If it did not, it would not be able to bind at all. Antigens binding sites therefore have some different structures depending on the antigen to which they are designed to bind. If y'all can remember, have some memories going on, when was the first time you heard of IgG and IgM? Anybody recall that? See if y'all are typing anything. Make sure I'm not missing anything.
We didn't study that at South Terrebonne High School there, Chris.
I know. See, I even know where Terrebonne is. I'm good for that. We'll send all my patients to Terrebonne from offshore. So it hasn't actually, that what I was talking about, the IgG and IgM, is not too long ago. That's when it all started with COVID. So if y'all remember, a lot of the tests that came out were from, you wanted to know if it was a particular IgG positive or were they IgM. That let us know if they had the particular antigen for COVID. So that was one of those big things they were testing to see if you were IgG or IgM, to see if you were positive or not having the antigen, or did you have the antigen. So that's when it really came out real big here recently, is so that we, during all this COVID testing and all that stuff. Michael, don't worry, man. I promise you it'll start making sense the more that we move on. I get it. I know, again, this is one of those, just bear with us. We'll get through it and it will move on, and then y'all be like, we talked about that? I was gonna wait till Lindsay finished typing her comment and I'll move on. Yeah, see, everybody's with you. You're not by yourself, Michael. All right. So the inflammatory responses. So inflammatory reaction to immune response are independent processes that often occur simultaneously. Most common causes of inflammation are infection and injury. Some acute inflammatory responses involves vascular and cellular components. During inflammation, some mast cells degranulate and release a variety of substances. After degranulation, mast cells release a vasoactive amines. Histamine and serotonin increases the vascular permeability, causes some vasodilation, and can cause some constriction, nausea, and vomiting. Mast cells also synthesize leukotrienes and prostaglandins. Whew. Different plasma protein systems are the complement system, the coagulation system, and the kinin system. That would be KININ system. The cellular components of inflammation. The polyomorphonuclear nutrients, which is PMNs, arrive at the site in the tissue where they are needed. The process involves two major stages, an intravascular phase and an extravascular phase. During the intravascular phase, the leukocytes move to the sides of the blood cells and attach to the endothelial cells. During the extravascular phase, the leukocytes travel outside of the body vessels to the sites of inflammation and kill that particular organism. The cellular event sequence is migration, activation, and adhesion, transmigration, and chemotaxis. Cellular products of the inflammation. Let's see. Interleukins attract white blood cells to the sites of injury and bacterial invasion. Interferon is a protein produced by cells which they are invaded by viruses. And lymphokines stimulate leukocytes. The macrophage activation factor stimulates macrophages to help engulf and destroy some foreign substances. Migration inhibitor factors keep white blood cells at the site of infection or injury until they can perform their designated task. Injury resulting and repair. Resolution and repair. How about that? Normal wound healing involves 4 steps: repair of damaged tissues, removal of inflammatory debris, restoration of tissues to a normal state, regeneration of cells. Wounds heal by primary or secondary intention. Primary intention occurs in clean wounds with opposed margins. Secondary intention occurs in large, gaping, or infected wounds. Those are those more pronounced, prolonged inflammatory phases. Factors that lead to dysfunctional wound healing may be local or systemic. Factors include infection, inadequate blood supply, some of those foreign bodies. Systemic factors include inadequate nutritional intake, leading to some insignificant levels of collagen. Anything that interferes with some wound contraction, hematologic abnormalities, diabetes, AIDS, and the use of corticosteroids. Some chronic inflammatory response is usually caused by unsuccessful acute inflammatory responses that is associated with an infiltrate containing monocytes and lymphocytes and usually involves some tissue destruction and repair. All right, that shows the inflammatory response from the time that you get a cut on the finger. We've all at least had a cut at once, and we know how the infection and all that you see on this side where it talks about the redness and the heat. You've had that at least, and it goes down here, increase in temperature, metabolic rate of cells. So basically what it's doing is it's increasing the heat and the cell growth to help the skin to heal itself. All right, so hypersensitivity is a response to the body to any substance to which a patient has an increased sensitivity. An allergy is a hypersensitivity reaction to the presence of an agent. Autoimmunity is the production of antibodies or T cells that work against the tissue of one's own particular body. Isoimmunity is the formation of T cells or antibodies directed against the antigens to another person's cell. Types of hypersensitivity reactions include type 1, immediate hypersensitivity reactions, occurs in response to a stimulus, degree of severity variances. Type 2 is a cytotoxic hypersensitivity. Those cells are destroyed by complement fixation or other antibodies. Type 3 is tissue injury caused by an immune complex. It may be systemic or localized. Systemic form is a serum sickness, which results from a large single exposure to one particular antigen. Its localized form is a Arthurus reaction. Type 4 is a delayed cell-mediated hypersensitivity. Two substances, delayed hypersensitivity and cell-mediated cytotoxicity. Feel like all of us are going to pharmacy school or to be a medical doctor. All right, right there is a type 1 reaction, allergic reaction. All right, so the immune system targets different molecules depending on the type of hypersensitivity reaction. An allergic reaction, the target is an antigen or an allergen. In autoimmune reactions, the target is a person's own tissue. An example of that is Graves' disease, type 1 diabetes, rheumatoid arthritis, and SLE. I'm not sure what SLE is unless y'all do. Y'all can tell me. Immune deficiencies. Immunodeficiency is the body's immune system in an inadequate and resistance to some infectious disease is decreased. It can be congenital or acquired. Nutritional deficiencies may depress bone marrow function and diminish white blood cells development. It can be caused by some trauma. Electronic immunodeficiency is caused by a medication or treatment, and replacement therapy is available for those immunodeficiencies. Oh, let's see here. Genetic, environmental, age-related, and sex-associated factors can cause or contribute to the disease. Controllable viruses, uncontrollable risk factor, or sorry, controllable versus uncontrollable risk factors. Uncontrollable factors such as genetics and race influence the development of the disease. Many other factors such as smoking, drinking alcohol, inadequate nutrition, lack of physical activity, and stress can be controlled. The risk of particular disease often depends on a person's age. In some cases, sex is related to the risk of having a certain disease. Analysis of disease risk involves consideration of a disease rate and disease risk factors. Causal factors, risk factors that directly cause a disease to develop. Non-causal factors, risk that are associated with a disease but not a direct cause. All studies of diseases should consider the incidence, prevalence, and mortality of the particular disease. Risk factors are age and sex differences often interact. Some common familial diseases and associated risk factors. A true genetic risk is one that is passed through generations by inheritance of a particular gene, and diseases with a family tendency seem to cluster in a family group despite that lack of evidence for heritable gene-associated abnormalities. Immunologic diseases are caused by hyperactivity or hypoactivity of the immune system. A person who has an allergic tendency is said to be atopic. All right, so this right here shows the pathogens of an allergy. First, you have the exposure to an allergy induces formation of a specific immunoglobulin, or the IgE. The antibodies is a susceptible patients, which then binds to the mast cells and basophils. Subsequent exposure to the same allergen leads to antigen-antibody interaction through activation of memory cells, liberating histamine and other mediators, form mast cells and basophils. These mediators include allergic manifestations. So cancer describes the pathologic associated with malignant growths in various anatomic areas. Prognosis often depends on the extent of its spread, metastasis, and the effectiveness of some particular treatment. Breast cancer is the most common type of cancer occurring among women, and we'll see. Sorry, I got sidetracked here. Diabetes, one of the most significant endocrine diseases, is associated with a particular insulin increased secretion or total lack of insulin secretion by the pancreas. Type 1 is insulin-dependent diabetes, and type 2 is a non-insulin dependent diabetes. All right, so hemolytic anemia is characterized by an increased destruction of red blood cells. This disorder has a number of causes, such as a Rh factor blood transfusion reaction, a disorder of the immune system, and exposure to bacterial toxins or chemicals such as benzene. Hemophilia is an inherited disorder characterized by excessive bleeding. One of the blood clotting proteins necessary for blood coagulation is completely absent. Hemochromatosis is an inherited disease in which the body absorbs more iron than it needs. Cardiovascular disorders. So cardiomyopathy is a disease of the myocardium. Mitral valve prolapse, coronary heart disease, is caused by an impaired circulation of the heart. Hypertension we know that's high blood pressure, and then stroke. All right, right there shows the comparison of a normal cardiac function with a malfunction characteristics of hypertrophic cardiomyopathy. And A on the left side is a normal heart illustrating unobstructed flow of blood from the left ventricle into the aorta during ventral systole. Hypertonic on the right side, cardiomyopathy illustrates obstruction to the outflow of the blood from the left ventricle by a hypertrophic septum, which impinges on the anterior leaflet of mitral valve. Renal disorders. Gout is an abnormal accumulation of uric acid and kidney stones. So, not real sure. I think that's the formation of gout. That if that's a kidney stone, that's rough. I mean, that's pretty big. So on there, it looks like it's got some crystals on there. That's where the crystals cause pain as a person has gout. And those crystals actually do the cutting of a particular area of the body.
In the book, it says it's a kidney stone.
Oh my Lord. That's what, 7 centimeters? Whew. You ain't passing that. That looks rough. Gastrointestinal disorders. We have some malabsorption disorders, lactose intolerance, Crohn's disease, peptic ulcer disease, gallstones, obesity, a body's mass index greater than 30 kilograms. Morbid obesity is a BMI greater than 40 kilograms or greater. Overweight is a BMI 25 to 29.9 per kilogram, and caused by genetic and behavioral environmental factors. You go by that, sounds like everybody may be overweight or more morbid obese. Jesus. Neuromuscular disorders. You have your Huntington disorders, muscular dystrophy, multiple sclerosis, Alzheimer's disease, some psychiatric disorders or some common psychiatric disorders have a family or genetic component, schizophrenia and or bipolar. I'm sure there's a whole lot more diagnoses to put into that. Stress and disease. I don't know if we can classify stress here. So stress includes a wide range of strong external stimuli, psychologic that can cause a psychologic response. Psychologic stress is a change that makes it necessary for the cells of a body to adapt, and the concept related to a psychogenic stress includes the stress factor itself is affected in the body and the body's response to that particular stress. Some general adaptation syndrome. This is characterized by 3 stages of reaction to stressors, physical and emotional. And our stage 1 is an alarm stage. That is when the body reacts to stress first by releasing catecholamones, epinephrine, adrenaline, norepi, dopamine. Stage 2 is a resistance or adaptation. That's when the body adapts to stress primarily by stimulating the adrenal gland to secrete some glucocorticones or mineralocorticones. The anterior pituitary releases ACTH, and the endorphins are then released. And then stage 3, you have exhaustion. The adrenal glands become depleted, decrease the blood glucose level, and results in decreased stress intolerance and progressive mental and physical exhaustion, along with illness, and then they ultimately collapse. Right here shows the psychological response to some stress. I'll let y'all read over that real quick when I get another glass of water. Right there shows how stress triggers the secretion of adrenocorticotropic hormone, which results in cortisol secretions. And then the effects of chronic stress. Hypothalamic pituitary adrenal axis controls reactions to stress. Continued stress leads to the loss of normal control mechanisms of hypothalamic pituitary adrenal axis. The adrenals continue to produce cortisols, which exhausts the stress mechanism that leads to fatigue and depression and interferes with some serotonin activity. A consistently high cortisone level suppresses the immune system, and the coping mechanisms play a role in the psychologic response to stress. The effective coping mechanism can help a patient improve his or her particular immune system's response. 2 seconds. All right, so that's going to be the end of the slideshow. So does anybody have any particular questions or anything about that?
Hey, can you start over?
I will. I'll be more than happy to. We're still going to have the same issues with me trying to pronounce those words, so fair warning. All right, so what I'm going to do is I'm just going to end the recording here, and we'll stick around for just a minute.
Is there any way that you can email us the